Hey, this is a little story from my life. This is not a happy story or can make you laugh, but it is a dark side of me. I covered everything well till today. I tried to look good even when I'm not okay. Every time I saw my reflection in the mirror, I can see the many weaknesses that I have covered all this time. I always laugh happily with other people but cry again when I go home. I feel have a lot of problems which make me not strong enough to face them. I want to share what I feel with other people, but I'm too scared if other people can understand what I feel, then view my weaknesses as bad in their eyes.
Depression is a common, yet often neglected public health problem and mood disorder that negatively affect more than 300 million people globally. Individuals suffering from depression often experience constant sorrow, hopelessness, and anhedonia, or unable to enjoy normally pleasurable experiences.
Besides the emotional components, depressive disorders possesses somatic components that often impede an accurate diagnosis. These symptoms range from chronic pain, digestive issues, respiratory problems, and cardiac problems. In addition to this, he must present as depressed mood, loss of interest or pleasure. Researchers have coined the name smiling depression or masked depression, where an individual might live with unrecognized or undiagnosed depression due to the facade of appearing perfectly happy or content. Smiling depression or masked depression is not officially recognized as a mental disorder, but is often diagnosed as major depressive disorder with atypical or uncommon features in a clinical setting.
About 1 in 10 people have depression, and between 15% and 40% of these people suffer from an atypical form of depression that resembles smiling depression. Depression often starts early in life and can last a long time. If you are suffering from smiling depression, it is very important to ask for help. Unfortunately, people suffering from this condition usually don't ask for help, as they may not think they have a problem. This is especially the case if they seem to be carrying out their daily tasks and routines as before.
Who's at risk for smiling depression? Some risk factors may include 1. Life-changing events. 2. Variability of individual judgment. 3. Social media. 4. According to Rogers' theory of self and personality. And 5. Expectation.
Smiling depression. Smiling depression is the moment when you smile, but you want to cry. You talk, but you want to be quiet. You pretend to be happy, but you aren't.
Sometimes the prettiest smile hides the deepest secret. The prettiest eye have cried the most tears, and the kindest heart have felt the most pain.
Don't give up. You are not alone. And you should know that you matter.